So Dwayne, I'm okay. All right, looks like we're live now. All right, guys. So just real quick, this is my first time trying to. Looks like we lost Skip, but he'll hopefully rejoin us. But I'm Ray Blackman, certified public accountant. Normally on my channel, I focus on stimulus-related stuff and small business-related information. But today, I wanted to venture out to an area that's near and dear to my heart, which is VA benefits. I'm a vet myself, and I'm going to have Alex Nolan kind of present his situation. I've got a VA rater on here, Dwayne, who's going to be able to give us some insights as well on how the VA process works and how it's. But Fatima, can you, how do you get this? Skip to join us. Can you get? Oh, okay. It's not a touch screen. I'm sorry. I was trying to do a touch screen here. Got another person joining us. Okay. Hold on for a minute. All right. Perfect. Okay. Sorry, you're having a little bit of technical difficulty. Sorry about that, Skip.
That's my fault. I was using my work computer, and even on my Microsoft Teams meeting with my employer, it kept freezing. So I went back and redid it on my.
All right, all right. So I think we got the glitches out of the way. So I was saying I was hoping to have just a general discussion today with you gentlemen, and if people choose to join in on the live stream, that'd be great. If not, we can at least start a conversation with ourselves, myself, Skip, who is just recently retired, and which is he can explain a little bit about how the program has improved over the last several years to make it easier for people just coming right off active duty to kind of put a claim in. He's one of these unicorns that kind of came off active duty and went from 0 to 100% right when he got off active duty at PNT. And then we've got Dwayne Kimble, who's a former Raider, 20 years at least over 20 years in the Army, and then went off to be a VA Raider at the VA. But I'll have these guys introduce themselves real quick, starting with you, Dwayne.
Sure. My name is Dwayne Kimball, United States Army veteran. Didn't do 20 years, but I got 20 federal years of service. Once I left active duty, I worked in the private sector for a few Fortune 500 companies, and I was awarded the opportunity to go work at the Department of Veterans Affairs as a RVSR rating specialist before I medically retired from there. And then it's just always been my passion to educate veterans on the VA disability compensation claims because I was able to maximize my benefits, but it took 4 years while I was a rating specialist. So I wasn't one of those unicorns, but I had the knowledge. But I just, after every turn, it felt like I was running into a buzzsaw. So until I was able to achieve that goal, and then probably about 5, 6 years after that, I end up medically retiring from the VA to still continue to educate veterans on the VA claims process.
Perfect. Thank you for that. Skip, just real quick, a little background on you.
Oh, yeah. So my name's Skip Harrison. I'm coming up on 1 year when I went on terminal, and about 7 months from when I actually retired from the Navy. I spent my first 10 years enlisted in the Marine Corps as a UAV operator. Got the opportunity to go through a commissioning program and was able to finish my last 10 years as a supply officer in the Navy. Really enjoyed my time in there, and just felt it was time to transition to to a new career and kind of settle down. I moved 9 times in my last 17 years, so my wife and kids and we're ready to to come back home and kind of put down our roots again. This is my first time meeting Dwayne, so it's nice to meet you. And as far as Ray goes, Ray and I served together over in Naples, Italy, and developed. We're kind of on the same mentality, and you're drawn to people that have a lot of initiative and a lot of and a lot of just want to seek out and do better things in their career. So me and him hit it off right away. We spent a lot of time over there together, and then just kind of continued our friendship from then on. Other than that, I'm just here to kind of share my experience, and since I just recently went through the process, and it's just hopefully it can help anyone. And if you can't really cover everything in this, so if anybody, Ray will put it out, but if anybody wants to contact me offline, I'm always willing to help anybody or already transitioned. So.
Okay, thanks, before I have Alex introduce himself, Dwayne is easy to reach. He has a channel, and we'll put a link to that afterwards. I mean, he's got a lot of good. And Skip, I know you don't know much about Dwayne yet, but you will later. He has a channel that has lots of videos out there. How many videos do you have right now, Dwayne, that covers different types of disability?
38 or 40.
Yeah, yeah, and counting. You just put another one up yesterday, not even
Yeah, yeah, I went
24
up
hours
last
ago. I
night.
saw that. So he's working to stay, and he's got a full-time job. So that goes with that. So Alex, go ahead, pop on and introduce yourself real quick.
Good morning, gentlemen. So my name's Alex
Morning.
Nolan. I've known Raymond since high school. Can you believe that? Many years ago. So let me let background of my story. I enlisted on an advanced pay grade in the Navy. So I basically went 2001. I was a Master Arms Security Unit, accelerated from boot camp. They said, "Hey, we want your skill set." I was security for the government, federal government position. I went to the reserves, and at a boot camp, I'm an E5. I'm like drilling reservist. So Raymond, he was an officer at that point, and he actually, I said, Ray, I got to get mobilized. I'm getting trained, and 1 week in a month, et cetera, et cetera. So we ended up going to Kuwait and Iraq, et cetera. When I got injured and demobilized, went to Lunstall, Ramstein, I came back to my reserve center. I didn't have any knowledge of what to do. Another veteran I had met at the VA in Washington, D.C. says, hey, Alex, you need to file a VA claim. So basically, I went from 10%, I would say up until last year, I was 100%, but I wasn't a permanent up until last year. So I was thinking for 7, 8, 9 years, they rated me at 100% the last 8 years, but I wasn't a permanent total. So I kept going to various VA hospitals, and I said I have to get documentation. I had to go to outside doctors, and I was just learning basically what to do from other veterans. I didn't know about the clothing allowance. I was at the VA, and they said, hey, you got a clothing allowance. So I wasn't aware of what benefits. And when I was told the clothing allowance is basically an annual amount of money that the VA will give a veteran due to worn clothing, or if you have a shaving profile, so it's wear and tear on your clothing. So simple as that, veterans are qualified for clothing allowance, which I wasn't aware of. And then Chapter 31 education, I wasn't aware of that until another veteran told me. So I received my bachelor's degree, and I became a member of Wounded Warrior Project, et cetera. So and I went to federal government jobs. So with Ray and I, we definitely appreciate you two with your time. And we're not subject matter experts. We're just basically veterans who want to give back and give a basically experience that we've had to assist other veterans. So Raymond's going to kick this off basically and see how things go. And we're hoping on other veterans can just tap into their experiences and to help other veterans. So I look forward to communicating with you and getting the ball rolling today and see how things go. I'll get back to Ray.
All right, Skip, just real quick, can you go through your experience, just recently come off active duty? Because I know that once we're done with this, I'm going to load it on my YouTube channel so people can have this for time and memorial. If a lot of people don't join in, they can grab it later. I know we're looking at a long weekend.
Yeah, no problem. So, as I mentioned, having just recently retired and gone through the process, I thought that the process was laid out really well. I'm one that participated in, and Dwayne knew it's called the PDD program. Whenever he comes on, I don't know the exact terms that go with it, but what that is, it allows you to file your claim while you're on active duty, and your claim pretty much goes to the top of the stack, and you're guaranteed to at least have your rating assigned by the time that you retire or transition out. And that way it just cuts down on the time for you to receive your benefits. And that timeline is from 90 to 180 days. And again, I went through this about a year ago. I'm sure if there's a couple errors on the numbers portion, Dwayne will correct that piece when he gets, because he's got more experience in this than I do as far as but for me, this is just what I experienced. So 90 to 100 days. So at 180 days, I went and I filed my claim, and everything was processed and waiting for me. And my timeline was I retired March 1st. The VA always holds 1 month of payments from you. And I began receiving, my benefits on May 1st, from the VA. So there wasn't much lag time except for that 1 month. And so that was really my timeline of events, but I did want to just kind of go into a couple of things I learned along the way that I wish I'd have known before, that might have helped me. I kind of discovered them on my own. I'm glad that I did. And so I just kind of hit those, real quick. So, like I mentioned, if you're active duty, do the best you can, even with this COVID going on, to get that 90 to 180 day to get your claim filed. And you don't have to have your C&P exams, compensation pension exams, or anything like that done. You just have to have that claim in the computer up to the VA that it's filed by that 90th day, and you'll have everything processed. They'll get everything done for you. If you're already out, I would say seek out like a local American Legion, a local DAV, disabled veterans, and see if they've got any veteran service representatives. Often they come in once or twice a week, and they'll help you file an initial claim, and help you out. Now you can file the claim on your own, but I would highly recommend that you utilize one of these resources. And to give you an example is, when you get your medical record, I scrubbed my medical record, and I found 9 or 10 things that I thought would be, a claimable injury, with the VA. I went and saw a very good veteran service officer, a VSO. And after we finished, he had about 32 items that he found in the medical record that, based off his experience, knew could be a claimable injury. So, they're there, there's no cost to use them. So it never hurts to let them take a look at your record. Plus they have all the computer systems, and they can scan everything and just get everything filed really efficiently for you, and give you a way to track your claim and things like that. So that was something that I learned about that. And as far as the VSRs go, it's just like anything else when you're doing research on different resources. Ask around, talk to people that have just recently retired, recently transitioned out. And I think you'll find, if you're in a fleet concentration area, or you're in an area where a lot of people are retiring or leaving the military, you're going to have 2 or 3 names that kind of surface to the top that you consistently hear. I went to this person, I was happy with this person. And those are the ones you want to seek out. I mean, I've heard, some stories where they didn't feel like they got really good representation. And then I've heard where, kind of like myself, my VSO was outstanding. And I think if you ask around, you'll find those 1 or 2 names that kind of surface. And those are the people that you want to go see. If you're active duty and you're doing this, keep in mind with that 90 to 180 day mark, if they're a really good VSO, they're going to be booked up. The one that I went to see, it took me 3 months to get in to see him. So I actually made my appointment, 90 days prior to my 180 day mark, just to get on his calendar. So that's something you want to keep in mind when you're looking for that. When you're getting ready to, as you think about filing your claim, or you're getting, to that point, and this is where I wish I would have done better over the years, even though it really worked out well for me. I wish I would have made sure that everything that I felt was an injury was documented, from a medical professional in my record, and not just once, or twice, but, even that little ache or pain, like in your knee or your elbow or your shoulder or something like that. Every year, even if you've gotten to the point where Tylenol or ibuprofen alleviates the pain and you feel, hey, that's the end of it, still go every year to your doctor and let them know, hey, it's still a problem with me. Can we try some physical therapy? Can you take x-rays to see arthritis there? Those types of things that show that continuity over the years of you having the injury. It makes it very important for the VA to have that historical data they need to give you the rating that you deserve. And I want to make sure I emphasize that word, deserve. You served in the military. You served your country. You've served on ships. You've served on deployments. This is not something that someone should tell you, oh, you think you're entitled to this or entitled to that. No, you know what? You deserve the compensation that you're going to get for these injuries, because they're going to affect you and be with you for the rest of your life. So don't feel. I've heard some people say, I don't know if I want to feel a claim. I don't. File the claim and get the compensation and other benefits that go with certain percentages that you deserve for serving your country. So VSO, good resource for those that may have gotten out, and even if you're serving active duty and you may be and you may have a mental health injury, statements from people that you serve with, the buddy statements. I used the actual VA form because I wanted to make sure everything, it looked exactly what the VA was looking for. So buddy statements of people that you served with, on deployments, even from your friends, from spouse, anybody that notices the injury. The way I look at it is, the more information, the better. The VA will discard it if they don't feel that it's relevant to the case or whatever. But, those types of things, especially if you've already transitioned out and you're trying to now go back and service connect something, nexus letters from doctors and those statements from individuals are be the best proof that you have, for those. And I'm gonna keep going here. I don't want to take too much of Ray's time here, but
No, no, go
here's
ahead. No, I think this is very helpful. So, yeah.
okay. Then I would say another, those two resources, people that that you've served with, and also VSO VSR. Another big resource that I found, and I don't get anything from this website. There's nothing. I just know it's a resource I used. It's called Military Disability Made Easy. It used to be a free site, and now it's a paid site. But what this site does is it gives you access to the CFR, the 38 CFR schedule. Something. It's a schedule for rating disabilities that the VA uses, and this is what you really need to become familiar with, so you can talk the talk of the VA. So, when you go and you file a claim, they're going to set you up with your CMP exams with a provider, a doctor in your area, which is what I had. Some of these, much like the VSO, VSR, may be good providers, and they may be very familiar with the CFR and know what kind of language they need to speak in to talk to the VA to get your rating, assigned to your disability. But some may not, with the spotlight on the VA and them trying to make sure they get through claims and appeals and things. You may be going to a new provider that may not be as familiar. So I would say that, using a website like that, or even going in and reading the CFR and finding your disability, what this does is it breaks it down by, if you experience this is what the VA will rate you on. So I'll say, like, tinnitus, like ringing in the ears. It's going to say 10%. If you have ring in your ears, you'll get 10%. Some of them are open into interpretation. So, for instance, a range of motion. If your shoulder goes 45 degrees, 25 degrees, and don't quote me on any of these numbers, you'll get rated 10% or 20%. There's all kinds of information in there about if you have a left and right shoulder injury. And again, Dwayne can talk more on this. There's a bilateral factor that kind of contributes in that can really help a percentage get boosted if you're experiencing an injury on a left and right, extremity, or a left and right foot, or a left and right, elbow, and things like that. So, and why I say become familiar with this is because the majority of the time that I've seen, while the providers may be, you may not have consistent, providers that know or providers that don't know the CFR. The one thing I have seen from everyone that I've talked to is that they are going to send you the paperwork with all of your injuries that you're claiming to you to fill out, things like where it occurred, how long you've had it, did it occur on a deployment, did it occur, during in a wartime, those sorts of questions about every injury that you claim. Now, you want to take this paperwork using the CFR, and then this is where you want to put that language, and you want to type it in there and have it ready for when you go to your appointment. So what I had all my stuff typed, ready to go, everything about my injury when I went to my CMP exams. When I walked in there were people coming in for their exam that day, and they were taking their paperwork, sitting out in the lobby, filling it out with pen, looking up at the ceiling, trying to remember dates. And this is going to affect their benefits and compensation for the rest of their life. And I just couldn't believe that somebody, for something this serious, would just sit out in the lobby and do that. And it's probably because they didn't know, and they didn't realize that this is the type of information you need to do. My stuff was all in PDF, typed out. And the reason I tell you to have it typed out so it's legible and everything, because when you go into the CMP exam, when the doctor examined me and he saw my injuries, he looked at my paperwork. As long as it's not way out of the ballpark, as long as what I've written down there is, what I am showing on the exam and my disabilities, which everything on there, that's another thing I want to point out. None of this that we're talking about is it has anything to do with, trying to put something on there that you may not have or don't like. All of these are legitimate injuries that you have. You just have to explain it to the VA in the right way so they understand. He's just going to copy what you've given him, and that's what he's going to put on the VA paperwork to send up for them to rate you. So the people out there that are writing stuff in pen or maybe not familiar with the CFR, if that provider's not familiar, he may just write up in regular doctor's terms and send it up. And now you're leaving it into interpretation for the VA to decide where it may fit, as opposed to you having it spelled out where it's in black and white where exactly it fits for your rating. So that's another thing I would say is take the CMP exam and that paperwork they send you very seriously. That military made easy by military disability made easy. It's a paid site now, but they do a 2-week free trial. So what that is, you can actually search your injury and it'll connect you right with the CFR law, the statute that says, here's your injury, here's what the VA says, here's what they're going to rate you based off the severity of the disability that you have. So and I think so yes, those were the biggest tips that I used when I went through. And like Ray said, whenever I submitted my claim, I think I ended up getting even though we submitted like 30 something things, I think service connected, I had about 11 or 12 items that ended up being service connected. And based off those percentages of those items, it did rate me at 100%. And believe it or not, I was at 100% for 2 or 3 months. And then I think they must have done a relook at the file for some reason, and ended up determining that I had it was a permanent and total case that applied to me, and so they gave that's what I ended up getting awarded as permanent and total. Another thing that I learned, and this is maybe if you don't get 100, I would say it's good for everyone to do, but especially if you did not get to the percentage that you thought you should be at. I don't know what the C stands for, but there's a thing called your C file. And the only way to get access to it is to fax the request. It goes to some place out Midwest. And sometimes it can take 4 to 6 months to get to you. But these are the actual notes that were written during your CMP exams. And it's going to have things in there like if your injury is static or if it's expected to improve. And that permanent and total rating, from my understanding, is based off the injuries, all your injuries and disabilities, the total of those, and whether they're expected to improve or whether these are static injuries that are not likely to improve. And when you reach a certain threshold of these are static and not likely to improve, then that's when a permanent and total rating, can be assigned. So I would recommend everyone, whether you're at 100%, whether you're trying to get to 100% or just trying to get what you feel you deserve as far as compensation and disability percentage, go request your C file and see when you went to that exam, if the doctor actually put in there what you were describing as a disability. Because let's say you had a shoulder injury, I'm only going to use one example, and you felt like you could only raise it up, halfway to like 50%, but he put in there your shoulder has full range of motion. You're not going to know that he put that unless you get that C file, and then you can make an appeal and maybe get another exam and have that corrected. So I'll finish up here with the reason that it's so important to get these benefits and these service connection is there are, from state to state, a wide array of benefits that you can apply for and be approved for based off your disability percentage, anywhere from no funding on your VA loan. It used to be free the first time you use a VA loan. That's no longer the case. I think you're at 2 point something percent, and then every time you use after that, it's 3 point something percent. Well, I think if you just have a service connected disability at all, you get to waive that funding fee. But go check the percentage on that to be sure. Other things are, even if it's a 0%, but it's service connected, you can get VA healthcare, you can get the prescriptions you need to go with it, things like that. And then as you get into higher percentages, you hit that 50% mark. If you're retiring, now you can get both a retirement check and your disability check. You can get both of those. And in the case of me for Virginia, I'm not like a huge hunting and fishing person or whatever, but there's things in Virginia like free hunting and fishing license for life if you have 100% disability. A big one in our state is if you're a permanent and total 100%, you're exempt from real estate taxes, on your home. So that can be a savings of $4,000, $3,000 a year, just depending on what your real estate taxes are. And 100% permanent and total qualifies you for your Chapter 35 education benefit. So if you got 4 kids like me, I've got a Chapter 35 benefit for them to go to school, once it's time for them for college. And if you're in a state like Virginia, you can double that up. Virginia also has a program for veterans that are 100% where they waive tuition for public school or public schools in Virginia. So if my kids were to go to a public school in Virginia, public college, their tuition would be waived, and on top of that, they would get a stipend from Chapter 35 benefits. So, the last one I'll say is if you've got a lot of people have student loans these days. If you have a outstanding student loan, and you reach that 100%, that student loan can be forgiven. It'll just be waived. And there's a lot of chatter on the internet that says, oh, well, you have to be permanent and total. I can tell you that's not the case, because mine were forgiven before I got my permanent and total status, because every institution has their own definition of what they consider to be permanent and total. And in the case of student loans, just that 100% mark qualifies for them to be a permanent and total rating. So even if you have 100% but no P&T, you can get your student loans forgiven and have those taken off. So and who knows what else in other states that come with certain percentages of veteran disability ratings and stuff like that. So I'll wrap it up with that. And I know that was kind of a big 25,000 foot view. Everyone's situation is different, and I'm happy to talk to anyone about it and see how we can help you. I know around here, even my brother and my cousin, I'm working with both of them right now to get, one of them never filed a claim, and the other one, was on, they had some mental health issues. Well, 5-6 years ago, they were moved from medicine as needed to daily medicine. And that right there moves you up in categories on a mental health VA rating. And so he never refiled a claim, for the last 5 or 6 years since he's been taking this daily medicine, now. So, just trying to help, help them and happy to help anyone else. So that's my so far.
That's a good segue for the Raider here to kind of line up what you just told him, if it's factual or is it needs to be amplified or clarified. Dwayne, over to you.
Yeah, my name is Dwayne Kimball. My role was a little bit different. A lot of things, it was interesting to hear with Skip, his process, what he went through with the BDD process, and that's benefits delivery discharge. That's what it is. Okay. So it's funny because I used to rate those claims. I remember when they came on board, and the only regional office that used to work those was Winston-Salem, North Carolina. Then they expanded it out to everyone. So I'll just go through, I guess, the process that I went through, and then some things that I saw and even see now working with vets. When I got out of the military, I didn't know, I was in the Army. I was at Fort Hood, Texas. I was ready to get out. And when I was going through our processing, my goal was to look for a job, to find a job. And back then they called it the ACS program. And when I went through it, it was okay, but no one told me about benefits. And when I had my separation exam, I went to what they call a TMC, the Troop Medical Clinic, for out processing. And one of the sergeants there, I knew I was stationed with in Germany. And he told me, he's like, hey, put no to everything on your separation exam. Tell them nothing hurts, because if you do, they'll hold you over. And I did that because I didn't want to stay. That was probably one of the worst things that I could have done. Luckily enough for me, and Skip mentioned this, I went to sick call and I still had certain things documented. Okay. And that helped. If I didn't do that, I would have been, I would have been in a world of hurt. But, like Skip said, if you're in the military now, and I don't know how it was in the Marines or the Navy, but you get to certain duty stations and the first sergeant would come down to sick call and ask you why you're on sick call and then tell you to leave. I sprained my ankle. Get up, leave, suck it up. And it doesn't get documented. You go to jump school. You jump out of planes and, you're trying to get your parachute badge, and you may have a slight high ankle sprain or just something that doesn't prevent you from running, but it hurts. You don't want to go on sick call because you don't want to get recycled or get kicked out of school or not being able to get awarded your parachute badge. So definitely, if you're on active duty, you want to get stuff documented, especially as you get towards the end of your career, whether you're retiring or ETSing. So once I got out, no one said, hey, Dwayne, you're getting your benefits. I mean, literally for 12 years, I didn't get anything. I didn't even know I could go to the VA. And the only way I found out that I could even get benefits is when I applied to become a rater at the Department of Veterans Affairs. And on the second day, someone said, hey, are you a veteran? I said, yeah. A young lady in my training class, she said, you can file for benefits. And I was like, oh, okay. And I'm like, what can I claim? She said, claim everything that hurts. So that's the second bad piece of evidence that I got, because by the end of the week, once I learned what the 5 ways of service connection was, I knew I wasn't going to get service connected for half those conditions. And I have that's one of my second YouTube video that I did. It's like I'm froze. Can you still hear me?
Yeah, I can hear you. Yeah.
Okay, I'll just keep
Yeah,
going then.
I can still hear you.
So I lost my train of thought. I filed a claim second day on the job. So my second video, YouTube video, is what is the 5 ways of service connection. And always when I talk to veterans on a daily basis, I'm constantly, when they're asking me about those conditions, and I say, well, under one of the 5 ways of service connection does that particular benefit meet? And the 5 ways of service connection is pre-service aggravation, direct, secondary, increase, and presumptive. And if whatever you want to claim doesn't fit under one of those 5 ways, you're going to get denied. So half of the things I claimed, I knew I was going to get denied. When I filed my claim, they didn't have like the third-party contractors like they have now. To get a CMP exam literally took about a year. It took me 10 months to get my first compensation and pension exam, also known as CMP exam. And I went in, and I was prepared by that time. I knew everything that I was claiming, the criteria for each condition. And the CFR that Skip mentioned, the Code of Federal Regulations, is where the rating scheduler is housed. So when you're talking about the different percentages, it's called the rating schedule. And if I have one sitting here on my desk and I'm froze right now, I was going to show it to everybody. But it has everything in there from back strain, neck strain, tinnitus, migraines, coronary artery disease, hypertension, PTSD, dental, neurological conditions like migraines, TBI, sciatic nerve, peripheral neuropathy, diabetic peripheral neuropathy of the sciatic nerve, femoral nerve, et cetera, et cetera, et cetera, et cetera. So, when I talk, and I do monthly training sessions where I talk about the VA claims process, building that foundation. What are some of the things you need to do first? How do you become educated? Once you become educated on the VA claims process, now you know how that process can possibly impact what you're doing. Okay. So that's the first piece. And it took me 4 years as a rating specialist. It took me 4 years to finally maximize my benefits. And what that meant was there was another rater or RVSR in another state that just kept telling me no, 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 no. And I'm like, wait a minute. I got the same training you got. I'm following the 38 CFR. I'm following the M21 manual reference, and you're still telling me no. I'm like, and I get these rating decisions, and there are errors, and those errors are called CUEs, clear and unmistakable errors, errors after errors after errors after errors. And I started to call the district office, which was in Nashville, Tennessee, and the district manager says, hey, one of his staff says, hey, you need to go to your management. I'm like, well, why do I need to go to my management? They don't have anything to do with my claim. And what I was complaining about was the raters that was providing me rating decisions were not following the 38 CFR and the M21. They were just not following it. And I'm like, okay, this is a problem. I shouldn't have to appeal this. And this appeal sits here for, back then, appeals like 4, 5, 6 years. I shouldn't have to do that because someone is not following the 38 CFR or the M21 reference, and I just felt that was a huge problem. So when I remember I went to the regional office director, and I remember walking into her office and she had no response to anything. I explained, why I was there, and she didn't say anything. It was just like, and it was nothing. And I would go to town hall meetings and it was like, oh, it's all about the vet. It's about the vet. It's about the vet. And now I'm in there as a vet and I feel I had a legitimate complaint, and she just brushed it off. It was brushed off. And I was like, okay, what is my next move? where do I go from here? And I had to basically start over with a game plan. And when I did that, that's when I started to be a little bit more successful, started getting a little bit more traction with my claim. But I had 4 CMP exams over the course of those 4 years, and I talk about it in some of my YouTube videos. And out of those 4 exams, 2 of them were horrible. The examiners didn't pay attention to what I was saying. And after about a week after I had those exams, I went to the Release of Information office and got a copy of those exams. And when I got a copy of those exams, guess what? Half the stuff that I talked about, the CMP officer or examiner did not document. And then there was questions that they were supposed to ask me that they never asked me, and they put down, yes or no, saying that that's the way I answered it, and that was incorrect. So from then, I made sure I started to build my claims file. And again, I had my claims file here, and I want to show everyone. But in one of my YouTube videos where I talk about what's in my claims file or C file, I did a video on that. But I started building that. I started making sure I kept a copy of everything. And when I did that, I gained a little bit more traction and a little bit more traction. And by this time, I was maybe in my 2nd or 3rd year as a rater. So I was really comfortable and familiar with, researching and educating myself on the 38 CFR and the M21 manual reference. And out of those 4 exams, 2 examiners, they were just horrible. I can remember that experience, and I share that with other veterans on my YouTube channel. But I can remember finally doing an appeal, and I get a lot of questions. I call it appeals, but now it's called a high-level review. And I get a lot of questions from veterans or comments that's left on my YouTube channel or through my website. They talk about high-level review. Oh, I got denied, so I'm gonna do a high-level review. And actually, that's one. I think that I'm gonna make that my next YouTube video is how do you fail at a high-level review? And one of those reasons why you fail at a high-level review and appeal is because, one, you're not educated, and then you're appealing something that you may never get because you're not educated. So remember when I said it has to fall under the 5 ways of service connection. I cannot tell you how many times I've talked to veterans or some of my clients, and they say, well, I'm going to do a high-level review. And I'm like, okay, well, does it fall under one of the 5 ways of service connection? No. So why are you going to appeal it? Because you're going to get denied on appeal. They run out, they get a lawyer. Guess what? They get denied on appeal because it doesn't fall under one of the 5 ways of service connection. And even if it does, and you get a compensation and pension exam, and then the rater tells you no, at that point, 9 times out of 10, it's not the rater telling you no, it's the doctor that gave you a negative opinion. So when you go ready to do a high-level review on appeal, how can you do that if you don't have a copy of that exam? You don't know why they said no. So you're going into it blind, and now they give you an informal conference. And also I did a video about the appeals and how I won my appeal. I appealed 8 things and I won every single one of them. First time around. And I can remember going into, and I had a VSO, and not that the VSO really helped me. It's just I needed them because I couldn't look at my claim. I was considered what they call sensitive 7. So as a VA employee, no one else could look at my claim. It was only certain people that could look at my claim throughout the country. And so he was sensitive 7. And I can remember going into the appeal, and you have 60 minutes to speak. He only spoke about 50 seconds. I would say maybe a minute. The other 59 minutes, it was all me. I had my copy of my claims file there. I had a legal pad. I knew exactly what I was appealing, why I was appealing, and why I felt I should have got an early effective date or a higher evaluation or actually service connected for something. And by this time, they had disability benefit questionnaires. And this is one of the topics that I definitely want to speak on is Dbqs. Okay. They had came out maybe like a year prior. And so after having so much bad luck at a CNP exam, I just started having my own doctor complete my DBQs, okay, and completing my nexus statements. And I actually created my own nexus statement template that helped me be successful, okay. So when I go into into the appeal, I get to talking and I'm going through my list, and I can remember I was appealing an early effective date for a particular condition, and they should have went back 2 years, and they only went back 2 months. Okay. Now, back then everything was paper. So what they did, they top sheeted my review, and what that means is they only looked at the top two pages. They didn't go back through the claims file and look at the evidence over the past 2 years. And when the decision review officer, she kept flipping. She was like, I don't see it. I'm like, keep going. And then as soon as she stopped, she saw that VA form 21-4138 day stamp where I requested an increase for that particular condition. And she was like, yeah, we have to go back, the 2 years. And then she said, well, are you willing to report for a compensation and pension exam? And I said, no. And I told her the reason why. And I said, I have a disability benefit questionnaire that's in my file accompanied with a nexus statement. So she looked at it. And the first thing I told her, I said, it's sufficient for rating purposes. So what that means is the DBQ was completed correctly. Everything was completed correctly, and it was completed by the correct medical professional. In the nexus statement, it included certain information. Okay. And I have a video. I actually talk about nexus statements. And that's the key piece that veterans fail to get. They'll say, they call them, I guess somebody came up with this IMO, independent medical opinion. I didn't know what that was until like 2 or 3 weeks ago. So that's not the only thing that needs to go in that nexus statement. In that nexus statement, the doctor needs to state what objective evidence that they review. What is the current diagnosis? What is the medical opinion? And a rationale. And a rationale is a statement of how that doctor came up with that positive opinion. Okay, that's key. Now, you can have a DBQ and a nexus statement, and that VSR at the VA or our VSR may still schedule an exam, and now you're at a crossroad. Do I go or do I not go? And I decided not to go, okay, because I knew that what I submitted was sufficient for rating purposes. I'm rating claims every day, so I know what needs to go in them, right? So I'm like, no, I'm not going to go. And you can use that information. And I told the decision review officer, if it's something in there that you feel that's insufficient, let me know, and I'll have my doctor to correct it, or you can call them and have them and get clarification per the M21 manual. They can do that. They don't normally do it because they don't get excluded time when they're speaking to the examiner on the phone. It's called excluded time. So what that means is everybody, the VSR, RVSR, the DROs, they're on a quota, and they got to push out these claims like I think the old Marine term, most Ricky tick. They got to get them out. They got to get them out. They got to get them out. So you used to, if you were on the phone with a doctor for an hour, you could take an hour of excluded time, meaning now you only have to do 7 hours of work in 8 hours. Now, if you're on the phone for an hour, you still have to do 8 hours of work within 7 hours. So now you're behind and you're rushing, and you could possibly make mistakes, So I don't know if it's still like that at the VA, but it was like that when I left. So, I go on and I said, no, I'm not going to go to the exam. You have enough information to go ahead and grant all my benefits. And about a week, 2 weeks later, I was sitting in the Dallas airport and I was doing some banking on my phone. I was like, oh, I think I won my appeal. And I won my appeal. And I won my appeal in 10 months. And people are like, how did you do that? Because back then it was like taking 5 or 6 years. Well, a lot of people don't know. Well, back then they didn't know you could request a conference, a video conference. So after that appeal gets certified, you can request a video conference. And guess what? That bumps you up. That bumped me from waiting 5 years. And actually, it shouldn't have took that long. I was dragging my feet about a couple of months. I didn't call to verify. I'm like, hey, y'all haven't, given me a hearing date. And when they gave me that hearing date, that bumped me up right there, and that's another video I did about RVSR hearing, because a lot of vets don't know that. So long and short of it, that's what I went through, and I was able to be successful. But I always, I didn't use any buddy statements.
Wow.
Back when I was reviewing claims, I didn't have time to look. If a veteran sent in 2,000 pages of stuff, you got to remember someone has to look at that, and that person is on a quota. They don't meet a quota in a certain period of time. Now they could possibly get fired. I had to purchase employment insurance. Like you have home insurance and car insurance. I had to have insurance on my job because, it was times, I always had a good quality rating. It was over 98%. My performance as it pertains to meet my quota, I was good. It was sometimes I didn't meet it. It doesn't matter if you don't meet it. I remember I had to make 79 production points every 2 weeks. And sometimes I would make 77, 78. And you talking about stress and pressure. And if you got to put food on the table and you could turn around and get fired, and then you got to go, hire a lawyer to get your job back, then that's even money when you don't have income coming in. So I was like, the last 2 years, I'm like, let me cover myself just in case, because, you never know what could happen. And that's exactly what I did. Never had to use it, but it was that, just that safety net. So you can imagine some of the stress and pressure that some VA employees are under to get these claims out, So, I think sometimes sending in too much information is not a good thing. And then you have to realize how much of that buddy statement is going to help you. Even you could still get service connected without it. But at the end of the day, it goes back to under the 5 ways of service connection, whatever you're claiming, where does that fall? And that's one of my first topics in my monthly training that I do every month. I spend at least, it's a 4-hour training, a minimum 4-hour training. It normally goes like 5 hours because I leave time for a Q&A. But that's probably the first 45 minutes where I'm talking about the 5 ways of service connection. You got to understand it. And so once I was able to reach that peak, okay, then there was other benefits, and Skip talked about them, the property tax. And the crazy thing that happened to me, I was actually 100% P&T, and I still had that appeal pending. So when I won that appeal, guess what? That effective date went back 2 years. So then I went back to my county and I said, hey, wait a minute, I shouldn't have been paying those taxes in the first place. The VA screwed up. Guess what? I got that back pay back. A lot of, I live in Florida, but I was telling other veterans about it, and they said, well, I'm going to go to my county. Not every county does it. So you have to go to your appraiser's office and see. And also, when I did my student loan discharge, now it's a little bit different. Back then, they would give me a 1099, and I had to report that as income. Okay. Now they don't do that. And I'm actually looking at their website, and their website is disabilitydischarge.com, and they got in bold letters, Total and Permanent Disability Discharge, TPD program. Welcome to the Online Information Resource Center for TPD Discharge, William D. Ford, Federal Direct, and other stuff. And I did a video about this maybe a week and a half ago, and one of my subscribers says, hey, they don't do 1099s anymore. And I said, well, remember in the video, I stated that's what I went through, but this is a program outside of the VA. Make sure you call them because it could have changed. A lot of veterans, they look at stuff and they don't want to go back and do that research. You have to do that research. Somebody told me I couldn't do something on my taxes. And Raymond, you may be familiar with this. I spent about 2 hours reading tax code section 162 subpart A, and I'm like, wait a minute, so I had to take the time to do that research. Okay. So now I call the the program. I called the department and I said, hey, how does this program work now? And it changed, not a lot, but it changed. So they no longer send the 1099. But one thing that she told me was, and this was very important. She said, once you become 100% PNT, they get notified. And if you have a loan that's due, what they'll do, they'll send you a letter. And if you don't respond to their letter, they will automatically discharge it. Now, that's a good thing. But I was talking to a veteran where they said, well, hey, I still want to go to school. So they discharged the student loan. So he had to go back and say, no, don't discharge it, undo it, got it undone. And then he went back to school and he took out more loans because that's a one-time benefit. Once you use it, you can never use it again. So she said, if you are continuing education and you're 100% PNT and you're still in school and you still need loans, do not use this program because you won't be able to discharge, any other loans. But one good thing, you don't have to report it as income now, But if you get that letter in the mail, if you become 100% PNT and you get that letter in the mail, then you definitely want to respond saying, no, do not discharge them at this time because I'm still going to school. Okay. And another thing that Skip talked about, I want to touch on is the chapter 35. Somebody came on my YouTube channel the other day and they was like, oh, you don't know what you're talking about. They'll pay for the whole school. No. And, I didn't respond because I had to give it 24 hours, but I was like, no. And Skip was dead on. He was dead on of what they do in the state of Florida. If you're 100% PNT, you contact the state Department of Education. It's a deadline. You fill it out. There's certain information. You fill out the application. There's certain information you have to submit with the application. And as long as it is a state recognized school, they will pay that tuition, not room and board, not books, tuition. And then the federal government will give a monthly stipend. And that monthly stipend, if you're going full time, I believe right now it's in between $1,200 and $1,300 a month. But it's prorated depending on the number of hours that you're taking. A lot of people think, oh, I get this $10,000 bill in the mail. Oh, let me just send it to the federal government and they're going to pay it. It don't work like that. Okay, it's a little bit more complex. And also, I just wanted to mention that, there's other benefits out there in the VA, okay, but they're not on the benefit side. They're on the hospital side. Skip talked about a little bit, clothing allowance. I was just on the phone with a supervisor at my local, I think it was Alex. Alex had mentioned the clothing allowance. And they suppose you get up to 4 clothing allowances every year. So I submitted the claim and they only gave me 3. And I was like, wait a minute. So I started calling. Nobody wanted to pick up. So I called the VA White House hotline, filed a complaint. About 4 days later, supervisor calls me. I say, hey, what's the problem? I haven't even received a letter showing me what I was approved for and what I was disapproved for. So I don't have appeal rights. And there was a long pause because she was like, I think she was thinking, how did he know about his appeal rights? And so she told me what was missing. I faxed it over. I followed up the next day. She said, yeah, I got it. And I was like, I need that letter in the mail for my records. I want to make sure I have it because next year, guess what I'm going to submit with that application? The letter showing that I was approved the year prior. Okay, so it's very important you start keeping this documentation. Another benefit through the hospital side is what they call the Caregiver Program. Okay, so it used to be only that veterans that were discharged after 9/11 could get it, but as of this month, it opened up to Vietnam veterans. And then 2 years from now, it's going to open up, I think October 2021 and 2022, if I'm not mistaken, is going to open up to all other veterans that served before 9/11 and after the Vietnam era. And what that is, that's a benefit for your caretaker. So if your spouse is, cooking your meals, helping bathe you, or just doing 90% of the stuff around the house, then it's possibly you can be entitled to that benefit, and that benefit goes to that particular person, not the veteran. So if it's your spouse, I think it's up to $2,400 or $3,200 a month that they can get. Is 4 levels, so it depends on the particular. It depends on the particular level that they're able to get. But at the end of the day, I'm gonna wrap it up here. But at the end of the day, I concur with what a lot of stuff that Skip said. I have a few active duty clients. That 180 days is very important. When I'm working with an active duty member, their claim is they've already completed everything. We've done that STR scrub of the records. And I'll always have them to do it first, and they'll come out with like 12 different things. One of my active duty clients, I think she had like 22, and I found 48 conditions. And when she told me, she said, well, before they even finished, I still had 12 things that was deferred, and she was already 100%, and they had 12 other things. And I just want to end up with this. When you go through if you're active duty, if you're active duty and you go through that BDD process, you can submit that claim yourself. Okay, you can complete it, and this is what all of my clients did. We went through. I educated them on the process because I don't advise or represent individuals. So once they got educated on the process, they went through their packet that I completed. They looked at the packet, they completed their paperwork, and then they submitted it on that 180th day. Now, the key to this is you want that company pen exam while you're on active duty. And the reason is this. Say, for instance, you're claiming a condition that's not in your medical records. You can still claim it. They still have to give you a CMP exam. If you get a diagnosis on that CMP exam, now you can get service connected for that condition, because guess what? You have a diagnosis, and that comp and pen exam that you did on active duty is now a part of your medical records. Okay, so it is actual treatment on active duty. Now, if you wait until after active duty, now it has to fall under one of the 5 ways of service connection. And a lot of veterans do not know if they do that, then they need to look at 38 CFR 3.309 subpart A, which is 1 year presumptive, which falls under one of the 5 ways of service connection, which is the presumptive. Okay. And they can file a claim that way. So, it's very important. One is being educated on the process. And I do certain, several trainings throughout the month where I'm educating veterans on the process, and we're talking about 38 CFR. We're talking about the 5 ways of service connection. We're talking about how letter reviews. We're talking about Agent Orange exposure, Gulf War undiagnosed illness, individual unemployability, TDIU, diagnostic codes, the different evaluations, example wording of way your claim should be wording, some things that you should submit with your claim, and some things that you possibly don't want to submit with your claim. Like I said, I was able to be successful, and I didn't submit not one buddy statement. I think I only had like maybe 2 pieces of private medical evidence. But the big thing for me was when those Dbqs came out, understanding how they need to be complete, how they needed to be completed to be sufficient. And if you're using the nexus statement, what needs to go in that nexus statement? Yep. Can you hear me, Raymond?
Yeah, we can still hear you. Yep. Can you hear me?
Yeah. So yeah, I will leave it at that. I didn't want to take up too much time, but this is a topic that is kind of dear to my heart, because
Yes.
I felt that when I was working for the VA, the first week of training, my supervisor said, "Hey, you need to be an advocate for the vet, because the vet can't speak for themselves. So you have to make sure that you follow all the guidelines that are before you to help that vet be successful." Because you couldn't pick up the phone and tell the vet what they needed to do. You only had stuff in the claim. And then I didn't want veterans to go through what I went through. I felt at one point that the VA turned their back on me, and I didn't want anybody else to feel that way. So once I retired, I continued, through my business to educate veterans on this process so they can be successful at the end of the day. But it's all about being educated. And like Skip said, you have to become educated on that 38 CFR, and it stands for Code of Federal Regulations, and the M21 reference. If you don't, then you cannot speak the VA language. It's like Denzel Washington said, "We're not playing checkers, we're playing chess." So
Well, that's good.
yeah.
Thank you, Dwayne. Hey, I'm gonna let Skip kind of jump in a little bit, but Dwayne, my technical advisor, who's 16, my daughter said all you have to do is for you to get unfrozen is kind of click off and then call back in. I don't know if you want to stick
Okay.
around. Or do you have something
Yeah.
else going on?
Yeah. I can do that. I can do that.
Yeah,
Give me one second. I'll be
yeah. So
right back.
Skip, do you want to respond to that real quick? I'm gonna go get my technical person to make sure everything's good. So you go ahead and respond to what you heard from him on some of that.
Yeah, I was making a few notes there. One of the things I wanted to mention from my previous comments that I forgot was two things. One, when you do your CMP exams, so for instance, I'll use an example. I have in my feet and ankles, I have plantar fasciitis. I also have arthritis in my ankles, and I have bone spurs and things like that, which gives me a certain rating. Well, some days they feel better than others. Some days it hurts, a lot. If I walk a certain, distance or not, a certain amount of time, it's sore for a day like that. Well, when you go in for your CMP exam, exam like they're looking at you. Okay, he started looking at my ankles, and that particular day, how are your ankles feeling? And I said, oh, general, how are they, right now, and they're feeling okay. They're not, they feel pretty good today. And he said, oh, and he went over to his computer and he started, typing in. I said, oh, what are you typing in? He's like, oh, I'm writing in that you said your ankles feel fine. And I was like, whoa, wait a minute. They feel okay now, but most days they hurt. Most days they give me problems. And so what I wanted to put out for people that may see this video, when you go to your CMP exam, you need to make sure that you're describing them in general, the majority of the time, how this injury is affecting you, or how it's disabling, to your daily routine and things, not necessarily what it may feel on that particular day, because that's what they're going to record. So for me, I was lucky that I caught him and asked him what he was doing, or my claim would have went up for my ankle piece. With that, I have no problems with my ankles, which that's one of the worst disabilities I have are my ankles, and my feet. The other thing I wanted to point out was that I meant to mention before is when you're filling out this paperwork for, the CMP exam is to, make sure you're, one, linking it to something, you can remember that happened, during the service. Did it occur during PT sessions? Did it occur just in your daily responsibility? Did it occur while you were on a deployment in a war zone or something? Because, that's all about that service connection, showing how it occurred there, or, it's also covered on something that may be aggravated, even if you had it prior to coming in. So, was it, it was fine, yeah, I had a little problem, but it was fine until I started doing this type of, this type of activity in the military. And now the injury's gotten worse than what it used to be. So just making sure you link it, to that. And then also another thing is, it's going to ask you in there how it might affect some daily, activity. So maybe you have a shoulder injury that when you reach across to grab a seatbelt or something, you get like a sharp pain or something like that. Maybe when you have to try to lift and put on, a shirt or button up shirt or something like that, when you have to lift your shoulder up above your head to try to put that on, it gives you problems. So any of those daily activities, those daily life things that you're going through that affect you, those are important to the rater. And one thing I really wanted to hit on what Dwayne said, it's good. I didn't know this until he was speaking as a rater there about their quota. And that takes me back to the CFR speaking their language. Like, I'm sure Dwayne got from one extreme to the other in claims that he received. And so, if he gets one where he's got to decipher, what they're trying to tell him and somehow link it to the CFR, it's gonna, I don't think your outcome is going to be as, as positive as if he gets a claim and in the actual claim is language written right from the CFR that he doesn't even have to try to figure out or try to assign a rating. It's in black and white what the doctor said. It's in black. It matches what's in the CFR, and now he can assign that rating and move on. You know, he doesn't have to try to justify maybe why he's doing that rating. I think very important there what Dwayne said, coming from a rater and what kind of quotas they deal with to make sure to make it easy on the rater by giving them that language, you know, out of the CFR. Just a couple other points I wanted to hit is I mentioned a lot about the kids being Chapter 35 and stuff like that. That's also your spouse, covers your spouse too. So maybe if your disability has maybe prevented you from getting the type of employment you want afterwards, and spouse may now gonna maybe try to pitch in or try to head out into the workforce. She can kind of jumpstart her career with that with some of that education. Even though it's 90 to 180 days, some of my friends that have recently retired have talked about, trying to get those CMP scheduled with COVID and things like that. So especially during this time, I would err on the side of caution and really try to do it at that 180-day mark to give yourself the most, time possible. And finally, for me, I think I would wrap up and say, Dwayne hit on it. And I know it was a huge factor in doing my claim. You're going to be your best advocate for claim, and you're guy, the VSO person there to help you. The rater is going to try to look at all the information and like he said to be the benefit for the veteran. But getting in there and digging and reading and being knowledgeable on this information is what's going to give you the most positive outcome with your claim. And I think we all hear they always say, don't drop the pack, don't do all that. Well, the reality of it is when you're retiring, the Navy, they're going to fill your billet. They're going to fill your seat. The military is going to march on once you're gone. So you need to take that time at the end of your career when you're transitioning out to make sure that you're set up as best possible to transition out to your next career. And an example, I just happen to have this around, this type of stuff like right here. These were all my files from all my medical as I went through and got out, all flagged, highlighted, everything with CFR notes written beside them, where you could find them, all of that information in there so that, I was prepared, for what it is I needed to, what I needed to do when I got out. So that's what I would say, don't feel like you're dropping the pack or anything like that. You're preparing yourself. And if you're at a good command, I was very fortunate to be at a command for my last tour that was very supportive and understood that it's very important for the military member to be prepared and ready to transition, or you can run into a lot of problems if you're not properly prepared, which I'm sure some people have experienced being at a command that maybe made you work 12 hours a day right up until and you had no options of getting ready. So, but yeah, that's great. I tell you what, that was great insight by Dwayne from the Raider side to see that they do have quotas. They do have certain things they have to meet and get those. When it comes across their desk, they've got to get it out. Which to me, makes it the more important to make sure that you're speaking their language to make it a lot easier on them to assign that rating.
That's great. Thank you, Skip. I think that Alex wants to jump in here real quick before I let you guys go. Hold on for a minute.
All right. Okay, I have a few questions. First of all, I want to get back. I appreciate both of you too. I want to just go over my situation. My son received Chapter 35 education. The issue is we got to remind veterans to take your dependent off of your dependency claim. I advised the VA that my son has Chapter 35 education benefits, but they still actually paid me while he was on my claim. So I have an overpayment due. I think Dwayne can follow up with that. So you cannot receive dependency claim, having a dependent on your claim, and that same person is attending school because they have this separate Chapter 35 benefit. So I basically thought that once my son received Chapter 35, he would be automatically taken off of my dependency claim, which the VA still has not done that. So I have an overpayment personally. So we'll see if Dwayne can follow up if he has the information on that as well. And the other thing, as far as the 100%, you will receive a brown ID card. I'm not sure if they are changing the color, Dwayne, but this is indefinite. It does not expire, and I realize your spouse will receive a card as well. The question I have for Dwayne is, my son had his dependency card. I was told when he turned 21, I went up to the local Deers, and they said he cannot have a ID card. So I'm not sure if he is college age. So I'm not sure if it's an age restriction, Dwayne, 21 being in college or 23. You have any input on that, Dwayne? Not sure if Dwayne's on. Skip, can you hear me?
Oh yeah, I can
Okay.
hear you.
Okay. I don't know if Dwayne's on my side. He's frozen. Yeah, but I wanted to follow with that. But I do have through the chat. I do have a question from a current active duty member. He says, "Can you see a VSO even if you have not submitted an Appendix J retirement request?"
Yeah, I would say from my experience, I don't think that you probably would. You may be able to make an appointment if you think you're going to put one in, but for the most part, when you go see the VSO, that appointment is them.
He freeze out. We might have to. Don't do anything yet. Hey, Fatima, we need you. Everything's freezing out. Can you hear the wind? Is he frozen? What about Dwayne? Can Dwayne hear us?
We're having technical difficulty. We don't have any audio on our end, and Dwayne is frozen. We're gonna get hold one tight.
Huh? All right.
Can you hear me now?
Yep.
We can hear you.
Okay. Yeah, I'll go back. So as far as being able to see a VSO, typically those appointments when you go to see that VSO are for them to actually input your claim, and they're not going to schedule that with you until you have 180 days until you're within 180 days of approved retirement date. So I would guess that you probably could go always talk to a VSO, just to get some advice, or maybe they could give you some advice on what you need to do leading up to your appointment. You can probably always do that, but if he's asking about actual like go see the VSO to like start the claim, I think you probably have to have an approved retirement request before you can do that.
Okay.
That would be my guess.
All right. I think we
But I
lost.
think they are. But I think they are there for general guidance. Most of them are retired military or have served in the military. And if he's just looking for some advice on, hey, I'm putting in a retirement request. I'm going to be retiring. What do I need to do to set myself up for success? To have a, to be able to submit my claim. I'm sure that they would be more than happy to talk to him about that.
Right. I agree. I think we lost Dwayne.
Yeah. You have any more questions for Skip?
Another thing I want to discuss, getting back to the 100%, in the state of Maryland, I'm not sure of Virginia, vehicle registration. You will have no annual registration fees, or you can get a permanent sticker on your vehicle if you're 100% permanent total. So you, in the state of Maryland, you have a handicap plate basically with a handicap logo, and you'll have a permanent sticker. So it's you don't have to go renew your car registration on your annual. It basically is permanent.
Yeah.
Well,
Yeah.
let
And
me
you can
see.
go to
Skip can hear us.
I think you can go to military.com, or you can Google, VA disability benefits by state. And every state is going to be, different as far as what they offer, what they don't offer. And so, that's the best resource to go if, and decide, or to look at what your specific state, the type of benefits they have for disability percentages and things like that.
Right. That's true. And most people, they I know the VA.gov, you have e-benefits, you have My Healthy Vet to secure messages to your provider. And I agree with the paperwork trail. I mean, we get a little frustrated with, what do we need to submit, and the visits. And like you say, going to an appointment and feeling okay that day. And you got to let the rater know. And they're going to look at you. When I went into the office, they just looking at every step you take, your movements, your attitude. I suggest let that rater know, hey, during the CMP exam, this is how I feel. It may be embarrassed. You may feel like, I had a young lady, for example, and she was about my son's age, actually. So I didn't feel like I could communicate with her. But you have to communicate, veterans, to let the CMP world and the VA understand that you are filing a claim and you have issues and you might have not known about and you're just learning about. So you have to be open up, and you have to basically just have everything documented and make sure that you can appeal. And most of veterans, we don't appeal. We get a rating and we say, hey, whatever percentage you may receive, oh, this is what they're giving me. But I always suggest go back and appeal the rating, because like you said, they can change it over time. It may take 3-4 years and receive a retroactive payment, but definitely document and see multiple doctors, non-VA and VA doctors.
Yeah, and then one thing we talked a lot today about, going up to that rating. If you're active duty, filing the rating while you're in to get that process going. If you're already transitioned out, seeking out the resources to file that initial claim. I also think it's important to point out that once you receive your rating, you may choose to appeal. You may choose that you feel like that's a fair rating, or you don't have an option to appeal. Going forward after that. At some point in the future, there's a lot of discrepancy whether it applies to permanent and total or not or whatever. But regardless of what it is, sometime in the future, the VA may come back and schedule you another CMP exam to see if some of these conditions that may have been likely to improve, based off the doctor's notes, have in fact improved. So it's very important that even after you receive your rating and your transition out, is to continue to make those appointments, to continue to see those doctors and keep those issues that you're having, noted in your medical record. Because if it's 5 years down the road and the VA comes back and wants to schedule you for another exam on a disability issue, and then they at that time they can increase or they could reduce your percentage. If you've not gone to one exam in 5 years and then they decide they want to reduce your percentage, it's probably going to be an uphill battle for you to prove that possibly you still have that condition. If you've never, if you haven't taken the medication for it, or you haven't gone and renewed your medications, and still continue to take those. However, over those 5 years, if you've continued to take your medication, if you've gone to your appointments, if you've done your physical therapy and things like that, and then they try to, and your condition's gotten worse, but they try to keep it the same, you probably have a better chance at that time for an appeal, because you can prove that you've still had this condition over 5 years. So, the likelihood of it still improving over the next 5 or 10 or 15 years is probably not likely. And you have a better case for increasing, or possibly, if you're already at 100%, getting a permanent and total rating.
That's true. And I would, from what I've been told, and just basically the VA, they basically let your age as well. If you're 50 years old, 55 years old, they believe that the veteran at that point in their life, you're more chance highly that you'll get 100% permanent, because in your 20s, 30s, and 40s, they may assume that you're going to get better. Your wellness, your way of life.
And right, yeah, and that's another reason that C file is so important, because unless you get that file, unless you request it, and again, it's you can. I'm actually part of a Facebook group called it's called Veterans to Veterans Info. Veterans with the number 2, numerical 2, Veterans Info. I think we got about 700,000 people in the group. And it was started by I think a VA rater who now assists. You can search. You can do that search function. You can get all kinds of good information, off of that, off of that group. And that's one of the the things that they discuss on there is the, that C file, and they've got all the information how to obtain it. But unless you get that, you don't have any idea what your C&P exam doctors wrote on your conditions and submitted to the VA. So as Alex was just talking about, you may have conditions that they consider static, or they have conditions that are likely to improve. And those ones that they consider likely to improve, you can most likely expect additional C&P exams on those in the future. And so, and great. Hey, you know what? I think everybody, we all have the disabilities that we have, and and we're going to have to live with those. But there's some of them that we have, probably all of them that we have, that we'd much rather not have them or whatever. So if you do have a condition and it's going to improve and things like that, I think that's a great thing. But some of the ones, like especially the ones the doctors list as static, and those of us that have them know which ones that are probably not likely to improve just based off the way we got them, or how we feel with them and things like that. You definitely want to, you don't want to take a chance of having those reduced in the future, just because we didn't go to the appointments and things like we were supposed to do. So
Yes, and follow up with appointments. I know a lot of veterans. We may not manage our appointments. So if you have someone in your life to assist you with scheduling and reminders on your cell phone or some type of calendar, the key thing what Skip is mentioning, we have to go to your appointments. Yes, things come up where you may not feel well, or you may feel that it's not worth it that day to go, but the VA will track you, and if you don't go to your appointments, they're not going to increase your claim. You're not going to have anything done, and it will benefit you. It's not going to be something that's negative. So you have to go to claims. You have to go to claims, and you have to get knowledge, and you have to understand. And I want to go another topic. I want to go to the reserve unit. A lot of reserves may be separated, and they may just not even think about filing a claim. And the key thing is active duty, reserve, whatever branch of the military. The key thing we want to remind all our veterans to always consider filing a VA claim and start early. With so many channels on YouTube, and you can Google, and just the VA.gov websites. And Skip mentioned a couple of websites, which we're going to follow up with Skip and try to promote and communicate how can a veteran get from step one and go through the process, because it is overwhelming. Is where you don't know and you file a claim. You may file a claim, you may not follow up. There's so many verbiage over the last 15 years, and it's definitely is confusing. So the key thing is with reserves units, you have to start early, and you have to know that, hey, you can drill at a certain percentage. I'm not sure, Skip, are you aware? I believe Raymond mentioned if you're still serving on active duty or reserves, you can still be in uniform, and I believe get a 30% rating and still be affiliated with a unit. I'm not sure if that's still true, that you can be in the military and still receive a 30% disability rating.
That's probably more on the reserve side, and I think how that works is, yes, you can have your rating, but then when you come on for your drill weekends, or you come on for your 2-year AT, or if you're activated, up for like a year, then those disability payments that you've been getting are what's the word? They're basically halted.
Right.
They're put on hold. And then once you come back off those orders, or you come back off to where you're just a civilian again, I think you can pick back up and receive those benefits. But I've served all my time on active duty side, so probably Ray is a better person to answer that. But I do believe I was my last duty station, I knew someone that was a reservist, and I remember them mentioning that they got disability benefits, and that those were basically put on hold when they came on active duty orders. So
right. We'll follow with Raymond. He's gonna plug in his experience with this subject. Hold on tight.
Hey, Skip, thanks for sticking around. Dwayne said he was having too many issues. That's why I was trying to work with him offline to get him back on. But
I've got 5 minutes, and I got my son's birthday. So.
Yeah, I think it might be a good break. But what you said about reservists, I did a lot of my time in reserves. Reserves, I've heard of reserves having 100% VA disability and still able to be in, which blew my mind. I guess it depends on what it's related to, and if you can still kind of do the job. And so reserves, the reason why reserves can get it and still serve is because the triggering event to getting disability or VA claim is having a DD 214. On active duty, you don't get one until you're finished. Reserves usually have already served on active duty or some capacity, have gotten out and changed the reserve status. You know, Skip, I know you work with reserves a lot, and that's why you know a little bit about this. But what happens is when they separate, they got that DD 214, which is that triggering event, and a lot of them apply and then continue to serve and draw a disability. And you said rightfully so, when you're on, every year around June timeframe, they do a catch up and they determine how many days you were on active duty between your annual training and your drills, and they deduct that out of what you would receive or recapture it. And if you do go on active duty for a stint of time, then you're supposed to do a letter letting them know the dates you're going to be on active duty. If not, you'll be overpaid. So I think this is a good discussion. Skip, it went really long, and I appreciate all the time you put into this. But we'll figure out how we can continue to collaborate on this. I think it's very helpful for people.
Yeah, and I would just finish up. If I had the biggest points I would make if people transition or going to file a claim is, sort of what Dwayne hit on to, that CFR is the key. I don't know of any other website except that Military Disability Made Easy that is so so user friendly with searching for a condition and then linking you right with how the VA is going to rate you on it. It's I don't want to say it's unfortunate. It's probably not the right word. It is kind of unfortunate that it's not a free. It used to be completely free and you could do it, and then they decided, I guess because of internet traffic and website traffic, they figured is a good way to monetize a little bit on it. And
Yeah.
now there is a free trial for 2 weeks, which is, I'll be honest with you, if you've got your records and you're ready to go with your list of conditions, that trial is more than enough time to find what you need to. But I think you can also get it on a monthly basis. And honestly, I think it's like $30-something a month. It's well worth the $30 just to get it 1 month to be able to easily search those conditions and find exactly what you need to write in your claim for your C&P exam, your paperwork, to find this. That'd be the biggest things, that one. And then the second thing is, and this is just in general transition, but can go with the VA part, that those last months that you've got where that you were 100% leaving the service, start taking care of yourself and getting yourself prepared. It's hopefully you're at a good command that works with you. But even if you're not, not that it's a good way to look at it, but I mean, it's not like you're trying to get promoted anymore. You're not moving anymore. You're not trying to get another billet. You may just have to tell them that I got to take care of this stuff, and that's what it is. I mean, I was fortunate I didn't have to do that, but they're going to keep on. They're going to keep moving along. The unit's going to keep going, and you want to be as prepared as possible when you go. But so yeah.
Well, thank you, Skip. I'm hoping we can do more of this maybe through the weekdays and make them shorter. And we'll talk about reserve stuff. I got some people that were on the chat that said, hey, what about reserve? And I'll focus on that. And I'll probably do some videos and work with Skip. And then as those people need Skip's contact information, I'll work to get that to you. I know some people are interested in talking to you, Skip. So, again, thank you for your time, buddy. I know you have to go to your daughter's thing. And,
yeah, man.
All right, till next time.
Yeah, next time you're in Norfolk, let me know. We'll get together.
I will. Okay, thank you. Bye.
Bye, Ray. Bye.
Bye, everyone. And now how he say, I want to be able to save this. Yep.